Hi, my name is Tammy Wentworth.
How has Lubbock Impact Clinic changed your views on healthcare?
Well, I realize now that there's a lot more advances in medicine than, I had thought that there was before. I mean, things are a lot easier. Um, for instance, on the hepatitis C, if I have it, it's cured by a pill now, they say. And so that makes it a lot less, scary
I
to
see.
deal with and everything. So I'm not near as scared, but I also think, and I really believe this with everything I have, that if I wouldn't have prayed to Jesus and been a Christian and just prayed and prayed and prayed, that the outcome probably wouldn't have been as good. It gives you a better perspective of how your patients feel. How whenever they say they're scared,
They really are.
I know what that means now. And I know what it means to, it's taking me forever to feel better and to recover. I understand that.
Okay.
And I work, with older patients, and you think, you're going to get back on that horse and stuff, but getting back on that horse is a lot harder than you think whenever you get a little older. So, a lot better understanding.
Okay. You said you don't have any chronic illnesses of that sort, like hypertension or
No.
diabetes. No. Okay.
But that was it.
The free clinic impact made the difference in that.
They saved
Aspect.
my life, literally. They are going to save. Because it would have just been swelling and swelling and swelling, and probably by the time I would have broke down and went to the hospital, it'd probably been a really serious situation.
I
Because I'm a
see.
really big chicken. So,
That's good.
yeah, it would have been, but literally, they're saving my life. So, it's a really serious thing.
Hello, my name is Dr. Justin Pedigo. I am a PGY1 pharmacotherapy resident here at Texas Tech University Health Sciences Center School of Pharmacy in Lubbock, Texas. I've been working here at this clinic as volunteer work since July of this year, so it's going on 3 months strong now.
In your 3 months of working here, what are some of the biggest challenges you face in your job?
So far, I think a couple of the biggest challenges that I have run into are language barriers, and at times that can be a little bit complicated. I think it would be nice to learn a little bit more of a like expand my knowledge on languages, especially things specific to pharmacy. I wouldn't have to be necessarily fluent in the language, but if I could get by with specific directions for medications, maybe how to, count to 10 or say once or twice, or take this by mouth, or those simple directions that you can give, I think that would go a long way.
Comparing to your experience there, to hear what are some of the major differences that you saw?
I think the biggest differences coming from that type of environment to this one is there's no third party, there's no cash changing hands, and so with that there's also a limited formulary. And so trying to find drugs that work for specific patients with that limited scope is a lot different than what I'm used to. How many people are we impacting? How much impact are we having on an indigent population here? We do this every week, every Wednesday. We see different people every Wednesday, and we might fill for 30 different people. There are a lot of other things that go on here at this clinic as well, just aside from the pharmacy and the physicians that take care of people. They also have food and other type of things to just help people out. So I think it's pretty impactful.